Good evening, ladies and gentlemen. Today we're going to take a look at my favorite antipsychotics. We're going to go through a series of antipsychotics and rank them in terms of how good I think they are. We'll look at how effective they are in reducing your symptoms of schizophrenia and their side effect profile. If you think I missed an antipsychotic that should be on the list, please leave a comment below, and the feedback is appreciated. So we're going to get started. I'll put on my glasses here and we'll get started with the presentation. So overall, this is from a meta-analysis with 40,000 patients. It's 212 studies were included, and they ranked the antipsychotics by how effective they are. As you can see, Clozapine is the most effective at an 88% reduction in your symptoms of schizophrenia. This is all measured as the standardized mean difference. So standardized mean difference is the difference between the placebo and the drug itself. Amisulpride is number 2 at minus 66% effectiveness. Olanzapine, number 3 at 59%. Risperidone, 56%. Paliperidone, 50%. Clozapine, 49%. Haloperidol, 45%. Quetiapine, 44%. Aripiprazole, 43%. Sertinidol, 39%. Ziprasidone, 39%. Chlorpromazine, 38%, acinapine, 38%, lorazepam, 33%, and aliperidone, 33% effective in reducing your symptoms of schizophrenia. But now we'll look at some of the common side effects that are associated with the antipsychotics. We'll get started with a look at how many people discontinued taking the medication. And this is done with OR, odds ratio. An odds ratio of 1 is the same 1-to-1 odds between the placebo and the antipsychotic. In this case, all of these odds ratios are a decimal place, and that means they actually favor the placebo. So more people continued taking the antipsychotic than continued taking the placebo. And this is probably because the antipsychotic made their schizophrenia symptoms better, so they wanted to continue taking the drug. But you can look, Amisulpride is the best in terms of the least amount of people wanted to stop taking it. Olanzapine is the second least, Clozapine is the third least, Paliperidone is the fourth least, Risperidone is the fifth, Aripiprazole is the sixth, and haloperidol was the worst in terms of discontinuation. You can look through these lists, pause the video, and you can look through them at your own pace. Excuse me, they're at your own pace. I will note, just a note here, that 50% of people stop taking their medication. Within 6 months. So a lot of people will stop taking their medication, and that's because of how the medication makes them feel and some of these other side effects that we'll talk about, because antipsychotics are no joke of a medication to take. You really don't want to have to take them unless you really need them. Okay, so now let's look at weight gain. This is standardized mean difference between the placebo and the drug itself. Haloperidol had the least weight gain at 9%. Ziprasidone, 10% weight gain. Lorazepam, 10%. And at the bottom here, we had olanzapine at a 74% increase in weight compared to placebo. Now we'll look at extrapyramidal side effects, and this is odds ratio again. So clozapine actually had a 0.3 odds ratio, which means 70% of people saw an improvement in their extrapyramidal side effects when they were on clozapine compared to placebo. And this is actually not good, because the reason for this decrease in extrapyramidal side effects for clozapine, and likely for certinidol too, but I'm not sure, is an anticholinergic effect of clozapine. So clozapine actually reduces two neurotransmitters in the brain. It reduces more than two, but two main ones that I'll talk about here. And that's dopamine and acetylcholine. Acetylcholine gets reduced by anticholinergics, and that's what an anticholinergic does, is reduce acetylcholine. And that reduction in acetylcholine will stop the extrapyramidal side effects, which are tremors and turgor dyskinesia. And that reduction is actually not necessarily great. It is great if you have bothersome tremors, but it's not particularly the best way to reduce tremors, because reducing your acetylcholine leaves too few neurotransmitters in the brain, and it reduces your ability to think properly, and it increases your odds of getting dementia. You can go down this list here, but you can see aripiprazole is a 20% increase, 1.2 times odds ratio. Amisulpride is 1.6 times. Paliperidone is 1.8 times. Risperidone is 2 times. And haloperidol is 4.76 times. So that is not very good. A lot of people on haloperidol will get shakes. So that can be debilitating. So it might be a reason not to take haloperidol, just as the extreme weight gain might be a reason not to take olanzapine. Prolactin increase. So prolactin is a hormone in your body it's a lactation hormone. It causes breasts, and it can cause breasts to produce milk in both men and women. So we'll look at some of the side effect profile here. Aripiprazole actually caused a 22% decrease in prolactin. Quantapine, a 5% decrease. And at the high end, Risperidone caused a 123% increase, and Paliperidone, which is a derivative of Risperidone, caused a 130% increase. Okay, QT prolongation, odds ratio. This is to do with the electrical system in your heart, and it can cause heart rhythm abnormalities in people who take antipsychotics if they have a lot of QT prolongation. Lorazepam, and actually I think they messed up here. I don't think you should have a negative odds ratio, so I think this should be standard mean difference, and not odds ratio. So this would be, and that happens. I've made white papers and science odysseys I've gone down. But so let's just say this is standard mean difference, which is lurasidone causes a negative 10% QT prolongation. Aripiprazole is about even. Paliperidone is about even. Haloperidol is a 10% increase. And serdinidol causes a 90% increase. Amisulpride causes a 66% increase compared with placebo. Now we'll talk about sedation. You all know what sedation is. It's a loss of awareness in your surrounding. It's a drowsy feeling. It's not being fully conscious of your surroundings. It's a bit, feeling a bit under the weather. Amisulpride and paliperidone cause the least amount of sedation at 1.4 times odds ratio, 1.4 times increase in sedation, or a 40% increase in sedation. You can see it's still quite a lot. A 40% increase to sedation is a lot of sedation. So even the best antipsychotics tend to tamper you down a little bit, and this effect can be something you're trying to do, especially if you're manic. But if you're not manic and you're not going through a psychotic episode, you generally want to avoid sedation. But some psychiatrists will put you on very sedating medication to try and keep you more level-headed. But I try and take the least sedating medication as possible, and generally I think that's the best way to go. So Amisulpride and paliperidone are 1.4 times increase in sedation. Aripiprazole is 1.84 times. Risperidone is 2.45 times increase in sedation. Olanzapine is 3.34 times increase in sedation. And Clozapine, the most effective antipsychotic, is 8.82 times increase in sedation compared with placebo. Okay, now we're going to look at it. This is a chart from another study I looked at, and it's going through the comparative risk of adverse effects of antipsychotic medication, and it looked at a series of studies again. So it's a meta-analysis. So here are the adverse effects on the side here, and we'll go down this list. Anticholinergic effects are a reduction in acetylcholine. It can cause dry mouth, blurred vision, constipation, and other effects. These are anticholinergic effects. You generally want to avoid all of these adverse effects, I guess. Dyslipidemia is an increase in lipids. Extrapyramidal side effects or symptoms here are things like tardive dyskinesia, which is tremors. Hyperprolactemia is an increase in prolactin. Neuroleptic malignant syndrome is a very serious condition, but it's also extremely rare. So we won't talk about that too much here. But postural hypotension is getting faint when you stand up. Prolonged QT interval, we talked about that a little bit. And sedation, seizures, sexual dysfunction, type 2 diabetes, and weight gain. Now, if you go across this list, you can see first generation antipsychotics generally had a high adverse effect on yourself while you were taking them, and And then you can look at high potency first generation antipsychotics. Again, cause a lot of extrapyramidal side effects and a lot of side effects generally. Now we can look at some of the second generation antipsychotics. And you can see here that Abilify, Aripiprazole is generally considered one of the antipsychotics, if not the antipsychotic, with the least amount of side effects. So it's one of my favorite, as you'll see when I get to my ranked list. Clozapine has quite a few side effects, but is very effective. Olanzapine, quite a few side effects. Quetiapine, a little bit less side effects. Risperidone, a little bit less side effects, medium-high kind of. And Ziprasidone. I haven't studied Ziprasidone that much, but as you can see here, it doesn't have that many side effects. So if you wanted to consider taking Ziprasidone or Geodin, I guess you could consider that. Okay, so now I've ranked the antipsychotics that I think are the best ones to take. And Abilify is number 1 on my list. Aripiprazole, long-acting injectable, I generally recommend. Is a little bit better than taking pills, which create more of a peak and a trough in the amount of medication in your system. So if you can take a long-acting injectable, it reduces that peak and trough that you get with pills. Aripiprazole oral pills is number 2. Number 3, Paliperidone long-acting injectable. Number 4, Risperidone long-acting injectable. Number 5, you could take Risperidone, or you could take Invega, Paliperidone, Invega pills would also be a good in there. And for number 6, I came up with a somewhat unusual antipsychotic, but it's actually not approved in North America. So it's not approved in North America, but it is approved in Europe, and it is Amisulpride. And Amisulpride is a very effective antipsychotic, though you can see back here that it does cause a lot of QT prolongation at a 66% increase in QT prolongation. So you'd have to watch that if you do take it, but it is very effective at 66% effective in reducing your symptoms. So it is the second most effective antipsychotic. So it might be worth considering if you live in Europe. Clozapine is the most effective antipsychotic, but it should be used as a last resort only. And that's because it causes a lot of side effects, and it can cause a low white blood cell count, which can be fatal. So you have to take constant blood work while you're on it to make sure that your white blood cells are still there. I'd just like to note that generally they put you on one antipsychotic, and 70% of people will respond to that antipsychotic positively. 30% will not. And then if you do not respond well to one antipsychotic, they'll try another antipsychotic. And again, only there are 30% of people who do not respond to usually a second generation antipsychotic. And of those 30% don't respond. So then you try two different ones. Anti. And then you try Clozapine. And actually, so out of the 30% who do not respond to antipsychotics, then Clozapine is tried as a last resort. 50% don't respond to Clozapine. So that leaves us with 15%. And the people who do not respond to the second generation antipsychotics are called treatment-resistant schizophrenics. Those who do not respond to Clozapine are called ultra-treatment-resistant schizophrenics. And that leaves 15% of schizophrenics who do not respond to any medication and will continue to have things like voices, grandiose thoughts, and paranoia, and they will continue to have this to plague them without any benefit from going on medication. In which case, if you do not get benefit from medication, don't take the medication. So if you have zero benefit to your voices, your grandiose thoughts, your paranoia from taking a medication, then do not take a medication, because the side effects from the medication will still be present. And if there's no benefits that are also present, then you should not take an antipsychotic. So that's 15% of people ultra treatment resistant. All right, so there's some medication I don't recommend you use, and you can make up your own mind going through these studies I've shown you. But I don't recommend people take olanzapine. It causes a lot of weight gain. There was actually a class action lawsuit because it caused a lot of diabetes in people, and they won some money because to help pay for their diabetes, which was caused by psychiatrists prescribing olanzapine. So I don't generally recommend olanzapine. It is very sedating. It causes weight gain. Another medication I don't recommend is haloperidol. Haloperidol causes a lot of tardive dyskinesia, which is tremors. So if you get put on it, your odds of developing tremors are quite high. Some studies say up to 50% get tremors. Other studies say 16% or as low as 8%. So it depends on which study. But generally, I would not recommend you take haloperidol. And probably the 16% is the more accurate number here. Okay, so this is looking at mortality. This first point here is long-acting medication or oral aripiprazole leads to 33% reduction in mortality. And that's compared to taking a regular first-generation antipsychotic or a different second-generation antipsychotic. So the long-acting injectable medication or the oral aripiprazole reduces your risk of death by 33% compared to taking a different antipsychotic regimen. And if you take no medication, you are at a 56% increased risk of death. So this was actually a Swedish study of 30,000 patients, and that were 16 to 64 years old. So it's good to take the long-acting or the oral Aripiprazole, like I recommended in my favorite antipsychotic list there. So how do antipsychotics work? Antipsychotics generally block about 75% of the D2 dopamine receptors in your brain. And they block to various degrees D3 and D4 receptors, along with blocking other receptors like acetylcholine. Clozapine, like I mentioned, blocked acetylcholine, which is an anticholinergic effect. And olanzapine highly blocks histamine, which causes sedation. So that's an example of something that can cause sedation. They also sometimes have an effect on serotonin receptors too. Okay, here we go. Individuals have unique reactions to drugs. Therefore, one medication that works for you might not work for someone else. This is somewhat interesting. Some psychiatrists don't recommend mixing antipsychotics, but there's been a number of studies done, and you can mix antipsychotics, and the effects don't totally stack, but they somewhat stack. So there was a study done of mixing Clozapine with a second-generation antipsychotic, and it had some additional benefits on treatment-resistant schizophrenics if they mixed Clozapine with another antipsychotic. I will note here, it is better to recover without drugs. So if you can get by without medication, you can look through some of the other videos I've done. I've shared a ton of tips about improving your odds of recovery from schizophrenia. If you can get by without medication or take medication only temporarily, it is much better than constantly being on medication. So do try some of the other tips I've suggested, and look at my complete list of tips on my blog, which will be linked below. Okay, here are the sources, and that is the video today. I hope you found it informative. I hope you learned something. I hope you're on a good antipsychotic, or if you have to go on an antipsychotic, I hope you choose a good one. And I also hope that you manage to utilize some of the tips in my other videos to reduce your need for medication and to super level up your recovery from schizophrenia, because there are a lot of things you can do as an individual that a psychiatrist can't do for you that will increase your odds of recovery. So thank you for watching the video. Like, share, subscribe, drop a comment, and I'll be uploading another video shortly, hopefully. So thank you very much. Bye.